Hello, Mr. Sandusky. I was just looking over your test results and looking over your vital signs. It seems like your oxygen level is like a little bit lower compared to um, the normal. Have you been feeling short of breath at all? It looks like you've just been feeling short of breath like at night and then with increased physical activity. So, would you say that is the case even like when you're walking up the stairs, or if you're being physically active, like during exercise or anything of that nature? If you could clarify that for me, that would be great. Um, so based off of what we have right now, I don't want to make any like confirming diagnoses. There's some other tests I want to run. One of those just being like a basic complete blood count. It looks like we only checked your electrolytes so far. And what that blood count will tell me is what your hemoglobin levels look like. I can take a full look at your red blood cells. I'll check over your white blood cells and your platelet levels. Those are used to help with clotting, just to get a lay of the land of everything that's going on. You said nothing has changed within your diet, which is good. I did notice like a yellow hue in your skin, which could also indicate possible complications with like your blood or your liver. Have you ever had any liver issues? We can also do a blood test for that just to be safe. But if your blood test levels, like checking over your red blood cells and your hemoglobin count comes back abnormal, I want to run something else called just pulling up the name for you, a high performance liquid chromatography. So what that does, it better highlights the shape of your hemoglobin. It's very possible, just from like your descent, so nothing that you specifically have done, but a blood disorder that is common amongst like African Americans, Mediterranean descents, Asian, Middle Eastern, is something called sickle cell. So that can be passed down from generation. It can be inherited, and like there may be someone in your family that may carry the trait but doesn't have the disease, and just by like the patterns of genetics, if this were the case, you may just have it just from like both of your parents might be carriers, and may not even know it. That was a mouthful to get out. But what that means, if you were to have sickle cell, then the structure of your hemoglobin, so normally in the red blood cell, the structure maintains itself when oxygen binds to it, and then that oxygen is released into the tissues. But with sickle cell, when the oxygen binds to the hemoglobin and then releases, the red blood cell changes its shape. It becomes like an S-shaped, or like a sickle or a scythe that you may see in like farming. And when that happens, well, overall, with any type of anemia, it can present itself as someone feeling like more tired, having brain fog, cool extremities, which it seems like that is some of the things that you have been experiencing. So I will provide you, of course, once we get these test results back, that will give me like a definite direction of where things are going. But say if you were to have sickle cell, I will give you plenty of information on how to, it's a manageable disease, on what my plan is as far as to better help you learn what to look out for, how to manage it, and what medications to take. So there's a medication that increases the production of a certain type of hemoglobin that is not affected by the sickle gene. And then more information about what it looks like to be like. You want to make sure that you're properly hydrated, that you're eating a diet high in folate and B12, vitamin B12, which is helpful with the production of red blood cells. And also to avoid certain triggering factors that can send someone that has this disease into more of a crisis. So if it's really, really hot outside or really cold outside, that can exacerbate problems. But we will cover that once we get some more of these blood tests back. While we are waiting for phlebotomy to come and draw some more blood, I am going to stick you on a little bit of oxygen, just because I would like to see your numbers be above 95 while we're just sitting here, and you are at 91. So it's not anything that is like emergent, but I would just like to give you that little extra help while we're sitting back and waiting for them to do that. So let's start with the complete blood count, and then we'll wait for those results, and then we'll move forward from there. I'm here through every step of the way, but let's start with that before we head down any confirming diagnoses.